I'm John Hancock of the West Plains Water Coalition. This is Water Watch. Jennifer Sable is a senior epidemiologist and the section manager of environmental epidemiology at the Washington State Department of Health. She's responsible for coordinating responses to inquiries about potential cancer clusters involving environmental concerns.
I work with several colleagues at Department of Health who've been involved with this coalition, and since my group does the cancer work, they asked me to look at that. There were some concerns about cancer in the community, and so we have done this analysis, and I still consider it a work in progress, so I really want to hear your questions and concerns and comments on it as I go. It's actually not one disease, but rather lots of different diseases. So there's more than 100 different types of cancer, and they each have their own unique pattern, I guess. They have different risk factors that people have that cause them. They have different treatment options. They have different rates of survivability. So it's not just one disease, but really many different diseases. They're just characterized by this abnormal cell growth, and that's what sort of holds them together. And cancer is not that rare. Actually, 1 in 3 people will develop cancer at some point in their lifetime. And there are many different risk factors and causes for cancer. There's lots of stories about people that smoke for years and years, lots of cigarettes, and they never develop lung cancer. Who knows? We don't know yet. But the risk factors that we do know about, one is age, unfortunately. Like as we get older, there's more cancer in our life. And so some of these risk factors are modifiable. You can change the thing, and some are not. There is genetics. There's behaviors, and this is one of the modifiable ones. So exercise, your diet, whether you smoke, use alcohol, those are modifiable behaviors. Infections, there are viruses and bacteria that can cause some types of cancer. And then the last one is environmental. In the state of Washington, there are about 44,000 cancers newly diagnosed every year. And there are I think between 12 and 13,000 cancer deaths every year. We used this map, which you saw outside, as our geography of where we're looking at the cancers. And we got that from the coalition. The kinds of cancers that we looked at are those that are most closely associated with PFAS. So kidney cancer and testicular, those are the 2 that have the most research that shows pretty definitively that those are risk factors for those 2 types of cancer. We also looked at breast cancer. There is some research that shows there's a connection and some research that shows there isn't. We also included pancreatic cancer. That one was a particular concern in the community, and the research has been shown in animal studies to have a link with pancreatic cancer, but not yet in human studies. We looked at all cancers altogether also. And the information that we use is from a cancer registry, and that is housed at the State Department of Health. Healthcare providers and medical laboratories send information about cancer to the department. There's a little bit of information about the patient or the person who has the cancer. We have their age, when they were diagnosed, their address, but not a ton more than that. And then, of course, we have information about the cancer itself. We use the newly diagnosed cancers in our analysis. The cancer registry also includes information about when the person dies, so we have that information also. So just because we're including newly diagnosed cancers doesn't mean we didn't include the people who died. The dates that we used in the analysis are 2011 to 2020. And 2020 is the most recent information that we have at this point in time to include in the analysis. I will be going back every year. We'll get another data set with another year, and we'll be doing the same analysis just to keep going. We compared that to Spokane County and then also to all of Washington State. And that allows us to compare the number of cancers at the West Plains to the county to the state, and to get a comparable number across those different geographies. So we did not find any differences in those three geographies. There are a couple limitations about this type of analysis. One is that we just know about the patient and their cancer. We don't know anything else about any of the other risk factors that they have. These types of analysis are also kind of a challenge for small populations. Some of these cancers that we're talking about are not extremely rare, but they're not that common either. And so when you're talking about a population of 25,000 in the West Plains, it's really hard to see a difference in these cancer rates. What to do about if you're concerned about cancer? One is to limit PFAS exposure. Talk to your Medicare provider about whether they can test your blood about cancer. And then the last is just there are those modifiable risk factors, and those are the ones that you have control over to change. We keep getting data every year, and so my plan is to continue to look.
When I saw an 8x11 handout, and the area that was used within it was really the city of Airway Heights. Now that we know there's a lot more from the airport coming through Palisades, are you going to expand the area where you're looking for this cancer cluster? And when we do the research on the type of health implications of PFAS, cancer is one of them, but I wouldn't say the worst or by means the only one. Is anyone looking at autoimmune disorders and the other things that PFAS causes? Is there any holistic health study done for our community outside of, as you acknowledge, you can only look at certain cancers and it's just a small slice of the pie of our health?
Cancer is the one that we have data for, and we don't really have data for immunosuppression or cholesterol or any of the other health conditions.
Two people who lived in my house before I bought it both died of pancreatic cancer, but they died in Florida.
So both cancer diagnoses, we do get them for Washington residents if they are diagnosed outside of the state, and that's part of the reason why it takes so long. If they were residing in Florida at the time they died?
They died in Florida, yes.
Yeah, then we probably may not have that information.
For the West Plains Water Coalition, I'm John Hancock.